This young man had an onset of headache and continuous symptoms of dizziness 6 months ago after a severe viral illness. It was hand, foot, mouth disease. And he had his continuous symptoms without improvement for several months. We met in about 3 months ago and started medication management for a diagnosis of vestibular migraine and possible PPPD. He's kept a nice diary that records responses to medications, and we're going to review that diary. So here we are in July, and what we're looking at are these colors. So orange days are severe, where symptoms are 8, 9, and 10 in intensity. Yellow days are symptoms are at 5 out of 10 and higher. And green days are not symptom-free. It just means that symptoms are below a level 5. So in July we met, and I did give you steroids to see if we could calm symptoms down. You took them in response to the bad day that you had, and you didn't have a succession of bad days, and that's good because you did have a succession of days prior to meeting. And then you had another bad day, tried steroids again. You started some supplements, magnesium, CoQ10, and riboflavin, which is B2, and you started to have a few lower intensity days, but you also started nortriptyline 10 milligrams. So that after 2 weeks, you increased the nortriptyline to 20 milligrams, and the lesser intensity days increased, and you started having lots more days with less intense symptoms. Now, you were still having symptoms. You had a little stress around your wedding with an increase in symptom. You went back to work and had some bad symptoms. You started, and you drank some coffee there, which for you might have been a problem, but who knows, going back to work might have been bigger.
Sure. Yeah.
The nortriptyline was increased to 25 milligrams, and then you had a random bad day, and then you had a panic attack, I know, and then there was a question about whether or not the nortriptyline was causing that. So you stopped the nortriptyline, and you started propranolol. And you actually, just a couple of days after starting propranolol, you had your first actual symptom-free day. That's amazing. And now you're still doing well, but no more symptom-free days, and you're starting the propranolol.
Correct.
Anyway, I just want to give you an A+ for your diary. This is not only helping me to help you, but it's going to help a lot of other people who can use this kind of tracking to help their physicians get them to the right solution faster. So what we're going to do is we want to increase your propranolol, which you seem to have responded to and tolerate fine. And we may even add a different medicine called venlafaxine, which is like the nortriptyline, but is actually a little better if anxiety is a part of it.
Sure.
And what we hope to do is to start getting symptom-free days. And once you start getting symptom-free days, the meds are working better, and you get strings of symptom-free days. And basically we're heading in the right direction.
Sure.
So thanks again for your hard work.
Of course.
And I'm sure it's going to be helpful to a lot of other people.
I hope so.
Okay.